This is Tyler Schneider from Las Vegas Weekly, and this is my feature story from the August 20, 2026 issue. Healing Loudly. As public perception and legislation moves, psychedelics could offer a lifeline for Nevada's struggling veterans and first responders. Editor's note. This story includes discussion of suicide. If you or someone you know needs help, the National Suicide and Crisis Lifeline in the U.S. is available by calling or texting 988. There is also an online chat at 988lifeline.org. From soldiers returning home from a tour suddenly haunted by the full weight of what they endured, to police officers, paramedics, and firefighters grappling with casualties they were ultimately powerless to prevent, Nevada's veteran and first responder communities carry a heavy mental health burden that too often hides in plain sight. Grim numbers fully bear out this reality. In 2023, according to Department of Veterans Affairs data, the state recorded the highest veteran suicide rate in the country at 61.2 per 100,000, more than double the rate of civilian Nevadans. And according to state officials, at least 26 of Nevada's first responders died by suicide between 2019 and 2023, 19 of which worked in law enforcement. For many, conventional remedies like antidepressants, sleeping pills, and rigorous talk therapy simply aren't cutting it. Clinicians call this treatment resistant, a label for patients who don't improve after trying 2 or more standard treatments. Nevada veteran Garrick Tucker inherited his burden in 2019 after sustaining 2 traumatic brain injuries within 48 hours while training for the U.S. Army Special Forces qualification course in North Carolina. Retired from service against his will, Tucker returned home to Carson City a changed man. Quote, I was in such a rough spot cognitively that if I were to go change the oil in my truck, I would have to watch the same YouTube video and write down the 5 steps because I was just not there, he says. I'd never experienced skin-crawling anxiety in my life, but I was so scared to go to sleep because my night terrors were so bad. The first year or so was me trying to tough it out, and it just was not working. He contemplated suicide on a minutely basis for 4 years, until a 2023 attempt marked a turning point that prompted him to seek help. But even after receiving care from a traumatic brain injury clinic in Boston, where he was placed on a regimen of antidepressants, uppers, downers, and ketamine, quote, nothing was changing. I would say I was regressing. Enter psychedelic drugs, which could represent a long-forbidden lifeline for people battling a range of mental health disorders, including the roughly 1/3 of PTSD patients who, like Tucker, are treatment-resistant. These drugs have been classified as illegal Schedule I substances since 1970, when the Controlled Substances Act deemed them to have high potential for abuse and no accepted medical use. Penalties for possession in Nevada are up to 4 years in prison and up to $5,000 in fines. But more recent clinical trials have started to chip away at the belief that psychedelics are inherently criminal or simply recreational. The Food and Drug Administration granted Breakthrough Therapy designation for MDMA, also known as ecstasy, in 2017, and for psilocybin, or magic mushrooms, a year later. While that status is a far cry from legalization, it does expedite the FDA's review of substances that could have legitimate medical benefits. Moving the needle further, in April, President Donald Trump signed an executive order directing the FDA to fast-track its ongoing review of psychedelic medicines and ordering federal agencies to loosen restrictions and build a pathway for eligible patients to access the drugs. The executive order only lists ibogaine by name, but days after Trump signed the order, former FDA Commissioner Marty Makary announced the agency would also be fast-tracking its review of psilocybin and MDMA. Quote, these medications have the potential to address the nation's mental health crisis, including conditions like treatment-resistant depression, alcoholism, and other serious mental health and substance abuse conditions, Makary said in a press release following the executive order. As this field moves forward, it is critical that their development is grounded in sound science and rigorous clinical evidence. We owe it to our nation's veterans and all Americans who are suffering from these conditions to evaluate those potential therapies with urgency. Nevada's awakening. As the national conversation about psychedelics has shifted, Nevada has been concurrently exploring the potential of psychedelic medicines since 2023, with Nevada Assembly member Max Carter serving as a key figure. Although the Democrat and career union electrician isn't a veteran, his advocacy is also shaped by immense trauma. First, in 2006, his wife Karen Carter was shot and severely wounded in a robbery of her business on Nellis Boulevard. Quote, I watched a woman who was a genuine badass and not afraid of anything all of a sudden have panic attacks, symptoms of PTSD, migraines, and other debilitating after effects, Carter says. Seeking relief, Carter started following some promising early studies on psilocybin therapy. One landmark 2016 Johns Hopkins trial put 51 cancer patients suffering from depression and anxiety through a pair of psilocybin sessions. 6 months later, 78% maintained a clinically significant drop in depression, while 65% met the criteria for full remission of their depression symptoms. Quote, at the time, they said it was like pushing the reset button on your computer, taking the clutter in your hard drive and putting everything back where it belongs, Carter says. Karen Carter was never able to try it legally, however, as she died in a tragic 2017 horseback riding accident in what was the darkest day of Max Carter's life. Quote, I have been very open and honest about my struggles with mental health since that time, Carter says. I became a trauma recovery yoga teacher, teaching in addiction facilities. Every time I turned around, I found myself running into somebody that was involved in the psychedelic movement. A grieving Carter turned to legal ketamine therapy, which harnesses an anesthetic that is not a psychedelic, but is often compared to them based on ketamine's dissociative effects and similar mental health applications. Quote, it took about 9 or 10 sessions to move the needle with me personally, and every 6 months to a year there was a high probability of me needing a tune-up, Carter says. I discovered that, if psilocybin or one of the others would have been legal, what was a very long process with ketamine could have likely been just 1 or 2 sessions. This journey informed Carter's decision to run for, and then win, a Nevada Assembly seat in 2022. Carter joined the legislature just as other Nevada politicians were starting to warm up to the idea of legalizing psychedelics. In 2023, Carter signed on as one of 2 Assembly co-sponsors of Senate Bill 242, which established a psychedelic medicines working group after representatives in both chambers collectively voted 56-4 in favor. 38 Democrats and 18 Republicans approved, with the dissenting votes all from Senate Republicans. Carter was appointed to serve on the group's 15-member panel of lawmakers, doctors, veterans, and law enforcement officials, which drew from more than a year of hearings to produce a 59-page 2024 report designed as a roadmap for future legislation. Quote, I figured there was going to be some guy with blonde dreadlocks that said he was a shaman. And yes, there were some highly intelligent, very well-informed neo-hippies. But the first person that stood up was a retired cop who is also a minister, he says. The coalition is just so broad, a beautiful thing that crosses all barriers. Re-elected in 2024, Carter pressed on in the 2025 session, co-sponsoring Assembly Bill 378, which would have authorized a state-backed alternative therapy pilot program, allowing veterans and first responders to participate in supervised clinical trials. It never advanced to a final vote, which Carter attributes primarily to budget limitations. Still, the legislature did pass a symbolic resolution calling on Congress to reschedule psychedelics and streamline research. Now, Carter is running for a 3rd term this November with the goal of bolstering this growing bipartisan coalition to hopefully usher through a successful version of the pilot program. Quote, I'm a firm believer in healing loudly, because when we heal loudly, we empower others to heal too, Carter says. We need to be more open and bring these things out of the shadows. A trip through the science. Before his injuries, Tucker, now 31, describes himself as a straight-laced conservative who didn't drink alcohol until he was 25 and never experimented with marijuana. But as his symptoms persisted throughout 2023, he tried MDMA. Quote, it was the first time in my life where I ever experienced compassion for myself, he recalls. I actually went 13 months without a suicidal thought after that. With his mind opened, Tucker connected with Reno-based nonprofit Sierra Psychedelic Society, which offered him a sponsorship to fly to Cancun, Mexico in February 2025 to undergo treatment with ibogaine, a psychoactive compound harvested from an African shrub, at the Beyond Medical Facility. Quote, "I felt like I had my 16-year-old brain back. It was like this cognitive reset and the ability to see troubling experiences in my life from a different perspective," Tucker says. UNLV researchers Dustin and Rochelle Hines have spent more than a decade investigating psychedelics as treatments for conditions like depression, anxiety, PTSD, addiction, eating disorders, OCD, and end-of-life distress. The neuroscientists maintain a Drug Enforcement Agency registration that allows them to process and study the Schedule I compounds. The common thread between these conditions, Rochelle Hines says, is repeated patterns of thoughts and ruminations. Most psychedelics appear to interrupt those cycles by acting on the brain's serotonin system, a sort of chemical highway that connects nerves, acts as a mood regulator, and influences sleep, appetite, memory, and learning. They do this by binding to the 5-HT2A receptor, which most antidepressants hardly touch. Psychedelics also promote communication between different brain regions in a process called neuroplasticity, which can give brains stuck in rigid patterns some breathing room to build new, healthier connections and combat stubborn compulsions. Quote, "Repetitive thoughts about using substances, about not eating or purging what you've eaten, those are the sort of patterns that need to be adjusted," Rochelle Hines says. Long before Dustin Hines served alongside Carter as a member of Nevada's Psychedelic Medicines Working Group, his career first went through big pharma companies like AstraZeneca, Sage Therapeutics, and Pfizer. He sensed something was missing. Quote, "I surveyed the scene and realized there has really been no major improvements to drugs for mental health since the 70s. We have some that are maybe less toxic or a bit safer, but no breakthrough drugs," he says. "Typically, when we had a new drug and it had 5% beneficial effects, we were celebrating. But some of these psychedelic-related compounds had 70% to 80% effects, and I was really struck with why we weren't studying those." Quote, "The clinical evidence just kept coming in stronger and stronger," Rochelle Hines adds. "It sort of forced us to reevaluate how these substances have been classified." Like Carter, the Hineses point to the 2016 Johns Hopkins psilocybin trial as a turning point for credibility. But other drugs under the psychedelics umbrella, like the ibogaine that spurred Tucker's new outlook, can have additional effects, like cardiac risk in high doses, that warrant further study. Quote, "Ibogaine is toxic at high levels," Dustin Hines adds, "but it's also probably one of the most powerful medicines that I've seen so far in the literature for addiction." Rochelle Hines compares the current trajectory of psychedelic research to willow bark, the plant used to produce aspirin. Quote, "In the past, we used to use it to treat pain, and then we figured out, what is it in willow bark that is actually doing this? And we discovered aspirin," she says. Psilocybin and ibogaine are kind of at that willow bark stage. Prepping for practice. To prepare for the day when patients don't have to travel out of the country to obtain psychedelic-assisted therapy, Dustin and Rochelle Hines founded Tesselit, a pharmaceutical company developing novel compounds and, quote, "modulators that can be used to modify a trip. If a session is too intense, Dustin Hines says one of these compounds might act as a dimmer switch to turn down the trip, for example. On the clinical side, the Las Vegas Center for Psychedelic Therapy can't offer legal psychedelic treatments yet, but it's already preparing for the day when the floodgates finally open. For now, the facility is permitted to administer ketamine treatments, guided by anesthesiologist and Air Force veteran Richard Bennett, who earned his certification treating blast victims at the Brooke Army Medical Center in San Antonio, Texas. There, he says, prolonged ketamine infusions routinely halved patients' opioid requirements in one day, resulting in hugely improved PTSD symptoms. Since 2021, Bennett has performed more than 5,000 ketamine infusions in southern Nevada. His patients also meet concurrently with therapists like Christine Lawler, a 17-year marriage and family therapist. Quote, "Being in practice for so long, I saw time and time again clients who were doing all of the work but kept getting stuck in the same cognitive loops and challenges," she says. "I realized that psychedelic medicine can unlock therapeutic healing so much faster. Things that we've been working on for years in session can get unlocked in a day. Lawler earned her psychedelic-assisted therapy certification from the Integrative Psychiatry Institute. She was in part prompted by the 10% to 20% of her current patients she says are psychedelic curious. And while she predicts legal psychedelic services could someday surpass her standard therapy practice, she stresses the need for responsible transition. Quote, "We need to proceed with caution. Therapists need to be highly trained, safety protocols need to be in place, and patients need to have respect for these medicines," she says, adding that insurance companies also need to agree to cover treatment. Clinical guidelines for psychedelic-assisted therapy, including the first professional standards released by the American Psychedelic Practitioners Association in 2023, generally follow a three-phase structure: preparation, administration, and integration. It's both the model Lawler trained for and the arc of Tucker's 9-week program. Quote, "The first 4 weeks are preparation, trying to build a foundation so that when you show up on site, you have tools to reference, an idea of what to unpack, and an awareness of what's going to transpire," Tucker explains. Then comes a week of treatment itself, which, for Tucker, included guided meditation, sound baths, group processing, and extensive coaching leading up to the ibogaine session. Quote, "It's like you do 20 years of processing in 12 hours, Tucker says. You're in a hospital bed, and you wear an eye mask and headphones playing very soft music. You also have an IV, blood pressure cuff, and an EKG hooked up to you the whole time, and you're monitored. The provider-to-patient ratio, I believe, is 4-1. That all needs to be the standard. The final 4-week period, integration, is an equally, quote, crucial piece. Quote, you had this phenomenal life-changing experience. Why? There's a deeper underlying reason, and that's what you start to solidify and make concrete in the integration process. Without that, the whole likelihood of lasting effects plummets," Tucker says. Patchwork reform. Nevada isn't the only state that has shown an interest in putting aside antiquated stigmas to address a pressing mental health crisis. A 2023 analysis on psychedelic therapy legislation, published in JAMA Psychiatry, found that 25 state legislatures considered 74 psychedelic therapy-related bills between 2019 and 2022. Of those, 10 were signed into law, while the rest died or were ongoing beyond the study's cutoff. The authors predicted that most U.S. states will legalize psychedelics between 2033 and 2037. To date, Oregon and Colorado are the only states with active legal psilocybin programs, though New Mexico is developing a third. Oregon voters passed a ballot measure in 2020, and the state began licensing supervised psilocybin treatment in 2023, structured as a cash-based wellness industry where no medical diagnosis is required. A typical session costs between $1,000 and $3,000, with only limited options for insurance coverage. Roughly 1/3 of businesses approved for a psilocybin service center license have since closed, leaving just over 20 operating today. Nevada Assemblymember Carter notes that the potential commercialization of psychedelic medicines may become a norm as states and the federal government roll out legal pathways to obtain the therapy. Quote, "My concerns are that, because of the highly structured FDA and DEA approval processes, we're going to see them emphasize ways to make profit off of this," Carter says. "I'm afraid that all of that organic movement that has proved that this works is going to get pushed aside for a big corporate takeover." He's not alone. A 2022 JAMA Health Forum analysis warned that short-sighted psychedelic policies risk repeating the mistakes of the cannabis industry, where rapid expansion in some states led to improper regulation and safety issues. Quote, "Psychedelics should not be on the recreational market like cannabis, but there are some things that we've learned from developing cannabis as a medicine that can be applied," Rochelle Hines says. Oregon also faces a challenge similar to what other states experienced with cannabis: a growing number of cities and counties implementing local psilocybin bans. It's a reminder that legalizing something on paper isn't the same as normalizing it in practice. Other models vary. 3 years after Denver became the first city to decriminalize mushrooms in 2019, Colorado voters approved a citizen-initiated ballot measure, legalizing personal use, permitting licensed healing centers, and creating a clinical facilitator license allowing providers to incorporate psilocybin into existing practices. Last year, New Mexico took another route by legalizing psilocybin through its legislature, establishing a medical program with aims to open to patients this winter. There are plenty of lessons to be learned from these early adopters, and Dustin Hines believes Trump's executive order may expedite the rollout for financially strained states like Nevada. Quote, "A lot of doctors and clinics are licensed federally, and state-level changes don't necessarily mean you won't lose your federal license if there's an issue," he says. The federal level is now greenlighting things, which will allow the states more freedom. How it all rolls out, I don't understand or know, as of yet, but it can only be beneficial for Nevadans if we could figure this out. An open door. The Nevada Coalition for Psychedelic Medicines has been at the forefront of Nevada's early push for psychedelic legislation. In a press release, the organization called Trump's executive order, quote, "the most significant federal action on psychedelic medicine in over 50 years. Ibogaine role in healing veterans like Tucker was at the heart of this order, with Navy SEAL veteran Marcus Luttrell and podcast host Joe Rogan largely credited for encouraging Trump to act. It notably provided $50 million for state-level research specific to the drug. While marijuana remains illegal in Texas, the state has also earmarked its own $50 million pool to conduct trials. The momentum feels like validation for Tucker, who now guides others through the process he credits with saving his life as a paid facilitator with the Beyond program. But the work is far from over. The next step will come when the FDA hosts a September 14th hearing to discuss its review, while a related bipartisan bill in Congress looks to codify the order into law. Quote, "This is the opportune time for Nevada to have the systems in place," Tucker says. "We have to create a container where people are willing and able to allow themselves to process these things in a safe environment." Tucker will continue to strengthen Nevada's advocacy circles through testimony in his own psychedelic-adjacent veteran support nonprofit, the Heartland Harbor Foundation. He predicts that most people will know somebody who's benefited from psychedelic medicine within the next decade. Quote, "I've run 50-mile ultramarathons. I've walked 1,000 miles in 38 days. I've been through special forces training. None of it was as hard as sitting alone with my own thoughts and finally saying out loud what was plaguing my mind and soul," Tucker says. "That's what psychedelics gave me." You can find this story and others online at LasVegasWeekly.com.